Hey everybody, this is our last lecture for Unit 2. We're going to talk about the muscular system. So like usual, we'll start with a quick case review. A woman in her late teens presented to the trauma clinic with an isolated fracture dislocation of the right navicular bone after falling from a scooter. She had no significant background medical history and complained of pedal myalgia upon plantar flexion. On examination, she exhibited noticeable edema, point tenderness on the dorsomedial surface, and ecchymosis on the plantar, medial, and lateral aspects of the midfoot and hindfoot. CT scan of the right foot showed a heavily comminuted fracture of the navicular bone. The subluxation of other tarsal bones, with subluxation of other tarsal bones. No other fracture was identified. There was no ligamental torsion and otherwise normal alignment of the ankle and midfoot. She subsequently underwent open reduction and internal fixation and was prescribed a week of Rice treatment and NSAIDs for acute pain. Okay, let's go through it one more time while we are defining some of these medical terms in there. A woman in her late teens presented to the trauma clinic with an isolated fracture dislocation of the right navicular bone after falling from a scooter. She had no significant background medical history and complained of pedal myalgia upon plantar flexion. So our navicular bone, you do not need to know all the bones in the body for this chapter. So don't spend all day trying to memorize those. But your navicular bone is right here at your midfoot, kind of. This bone helps to support the arch of your foot. So pedal, that's going to be our region of the foot. So pertaining to the foot, myalgia. Algia is our suffix for pain. My is our root for muscle. And upon plantar flexion. So plantar flexion is like a gas pedal motion, and we're going to go through the different motions of the joints today. On examination, she exhibited noticeable edema, point tenderness on the dorsomedial surface, and ecchymosis on the plantar, medial, and lateral aspects of the midfoot and hindfoot. A CT scan of the right foot showed a heavily comminuted fracture of the navicular bone, with subluxation of other tarsal bones. No other fracture was identified. There was no ligamental torsion and normal alignment of the ankle and midfoot. So dorsomedial, that is going to be the dorsal side of our foot. So that's going to be the top of our foot. This is the plantar side. So dorsomedial tenderness, that means it's tender on the top middle portion of our foot. So that's where your navicular is. So right below there, you can see it's kind of bruised too. That's what ecchymosis means. Ecchymosis is bruising. So you see that in a few different areas. And edema is just swelling. We've seen CT scan a few times. That's computed tomography scan. It's a fancy X-ray. And comminuted fracture is one that's broken up a lot. So I'm just going to mention a couple of different types of fractures. So comminuted is when we have a bunch of different pieces. A compound fracture is when the fracture actually breaks the skin. And then another one that you may see is a green stick fracture, and that is most common in kids. So we already said our navicular bone is that bone in the middle of our foot that supports our arch. Subluxation is similar to a dislocation, except for whatever structure is in question goes back in place. So if our navicular bone was dislocated, it would be all the way out of place and staying there. But with a sublux, it just means it kind of slid out of place and slid back. Our tarsal bones are our ankle bones. I said no other fractures identified, no ligamental torsion. Remember, ligaments connect bone to bone. Tendons connect bone to muscle. Ligaments connect bone to bone. And torsion is our word for twisting force. The ankle and midfoot were aligned okay. doing an open reduction and internal fixation, which means they're going to screw pins in her foot to hold those fracture pieces together. Sometimes you'll see that abbreviated ORIF, ORIF. And then RICE is a very common abbreviation that you may have already known before the class. So rest, ice, compression, elevation, and then NSAIDs for acute pain. So these are medications such as ibuprofen or Advil or Aleve, and it stands for non-steroidal, NS, non-steroidal anti-inflammatory, AI, so non-steroidal anti-inflammatory drugs. That's what the D and S stand for. It's just the plural drugs. Non-steroidal anti-inflammatory drugs, you'll usually just see or hear NSAIDs. All right, so of course, our muscles provide movement for us. They also maintain our posture, even if we're not actually thinking about using our muscles. If you're standing or sitting up tall, then your muscles are on to some degree to make sure that you can stay in a good posture and supported. So we usually term that as muscle tone. That's what helps